What do you have to say? First day of school. How do you feel?
Excited that I'm not a clinical student, but you work. I have to work harder now.
What unit are you starting with?
Oh, I'm going to be starting with the cardiology.
I'm starting with pulmonology, guys, and I really wanted to start with cardio. Hello, good morning, everyone. So this is going to be a vlog. I haven't been vlogging for a long time now because there hasn't been much happening, but I've officially resumed 400 level and I'm on my way to clinical postings. So I will have to get a bike, then from there go to the class area because I stay it's not so far but kind of far from school. So yeah, I'm just coming with me today, guys. I'm trying a new version of vlogging. I'll be doing less talking and more showing because, let's be honest, I think voiceovers are easier. So let me show them my badge. What unit are you starting with? How have you been enjoying your experience so far?
The experience so far is just enough time to get my head around. I still don't know what I'm doing.
Don't worry, everything's going to be well. Hello, good morning. It's currently It's currently 3:48. I don't know if this shot is too up close. Yeah, I'm trying my best to vlog as much as I can. Yesterday I went out. I couldn't show you a lot of things. I was able to get a lot of things from the market. Today I might go to the market again. But yeah, I was able to get a lot of things. Now I'm back. It's 3:48 a.m. in the morning, and I'm just trying to go through respiratory system, how to collect respiratory system. But either way, it's because I'm in pulmonology unit. But one thing I've realized is that because I'm in pulmonology unit doesn't necessarily mean I will only see pulmonology cases. I don't even know the kind of patient I'm going to get tomorrow, because when I even attended the ward rounds today, I was doing more of like nephrologic like cases and gastroenterology like cases. It wasn't like one case in particular. Yeah, so I don't know, because it's internal medicine, so you can like my posting, I started with medicine. So because it's internal medicine, you are not restricted to only one system, so you can be asked to clerk an endocrine case or asked to clerk a neuro case, so you don't really know what to expect, and it's very annoying, honestly.
But yeah, let me just show you guys what I'm doing. I just try as much as I can to like read what I can read, because to be honest, we can't finish all the systems today. Then prepare for school, go to school. I've been assigned a patient. Things are, I'm just hopeful that this patient is going to be a case that I know, at least I know how to clerk and arrive at it. What is S? In where? In Socrates. Site or severity? The last S is severity.
So what to eat the person complain of diarrhea? You asking of site again now.
No, now if you want to collect diarrhea, it's going to be quite different.
I'll just start
You
from
take some things from it, but you not like you don't ask site. We can ask onset when the diarrhea starts.
and describe how it is.
Yes, the character. I can also. Well, I don't know. It's more of
you can be like
that
if
you
it's,
ask
you can be like you can
projectile.
talk like if it is watery.
Okay, yes, you can see that, sir. Then for diarrhea, don't use to radiate now. Diarrhea will not radiate, so you can't really.
What I noticed about this thing, but there are some things that you will not see, you will not ask. That's what I've seen about this history.
Then timing, okay. Has it gotten worse over time, or has it subsided? Are you still having this diarrhea? And they should also describe the diarrhea, because this will say rice watery stools is seen in cholera. I think that is the kind of stuff. So they will describe it. What color is the diarrhea? Is there blood? You ask certain questions like that in case there's blood in stool. But I think it's going to be quite different. Socrates is usually for pain, so you just pick some things.
But the same most is basically pain.
It's not everybody that complains of pain, but most people is pain. But it's not everybody. If they ask you to crack headache, you go hear something, because headache is not. Headache could be due to so many causes. So I don't even like headache. I don't wish headache for somebody. You go just.
What would be the cure for headache?
It depends on the type of headache. Headache have different types, so it depends on the type of the headache.
What if the headache is too severe?
Like a migraine.
Like malaria 3+ now.
That one, now headache, but we have primary causes, secondary causes, and like primary causes are like.
Wait, under care, what are you meant to do? Are you meant to just discuss how to take care of the headache?
Under care,
you know, care is after complication.
Yes, care is not you. It's what the patient has done so far to care for whatever he has. So the patient can tell you, I've taken over-the-counter paracetamol and it isn't working, or I've taken my herbal drug and it's not working, or I've done cold compress and it's not working. They'll tell you.
But okay, but now that care will still be different from the drugs they are looking at. What are the drugs that you are taking, right?
Yes. That one will be different. Under drug history, most of the time you are asking about if they're on any medication. It does not necessarily mean as regards your sickness. Care of is what you have done for your sickness. Then for the drug histories, like previous, you've been taking, like some people will say I'm hypertensive, so they'll tell you the medications they have been on. You get maybe, but they are presenting you with a different complaint, but these are the drugs they have been taking.
You go to social history, talk about where you are living, from there you are going to family history, you talk about any disease.
Yeah. I don't know how to do this thing. It's just to practice, but with who will I practice? Just get better by getting more patients.
Is what?
Hello guys. Yeah, I think I'm going to be ending the vlog here, to be honest with you. Today I was supposed to have pharmacology, but the lecture didn't hold. Guys, give me a moment. I think I'll just open up the windows more. So yeah, I was supposed to have pharmacology, but the lectures didn't hold, so I ended up wasting my whole day, and I didn't go with my name tag. Today was very frustrating. I couldn't see my patient, because to get into the ward you need a form of identification, like they should see your name tag should be there, right? So I didn't have my name tag, so I couldn't go see my patient and everything. Guys, tomorrow I will be on call, guys. How will I be starting my first call on a Saturday? I prefer weekdays call, because you stay in the hospital from like 4 till like maybe 7, 8 at most, and sometimes the doctors will just let you go. But weekend call, we're told to come by 12 p.m. in the afternoon, and we don't know when we would leave, because we were complaining. Initially we were supposed to do 8 p.m. to 8 a.m. call, but we are medical students and some of us live far away, so they considered 12 p.m. So let's say 12 p.m. to like whenever the consultant or the senior reg or whoever is in charge lets us go. So guys, I've not done a room tour of my room yet. I'm just going to like show you a brief overview, just something small. I might do a proper room tour some other time, but for now I have to go to terminus. I have to get some things. God, today is going to be a very busy day. I won't be able to handle vlogging and market runs and everything. Yeah, I got this too, guys. I got a brand new blanket duvet, because this is my old one. I wore this today, and this is my school bag. So this is my old one, so I want to change this. So guys, let me just show you briefly how my room looks like. Yeah, I really love the fact that they went with this color, this white color, a bit of off-white. So yeah, this is my room. Book, the real ghetto. Hello guys, I'm really hoping that you can see me, guys. Today is my first call, and I'm just trying to prepare and arrange my stuff. I resumed last week, this week actually resumed this week, and I was given today, which is a Saturday, as my first call day. How do I feel about it? I don't really like weekend calls. I haven't done a lot of calls yet, but I know that for weekend calls, anything that will take me to school that is not a weekday is a big issue for me. Like, no, why am I going to school? So that's why I don't really like weekend calls. And the fact that you start early and you can be there for as long as possible. Normally your call is usually, as a medical student, your call usually starts from like for weekends from like 8 a.m. to 8 p.m. to 8 a.m. the next day. But due to security reasons and because you're a student, you are usually let to go early, and we begged our unit if we could come earlier, because some people stay far and it will be honestly risky for them if they leave by that. Sorry guys. Okay, yeah, it's going to be quite risky. Like, if it's going to be very risky for them if they leave by that time, since some people stay far. My place is not so far, but it's a bit far, but it's not as far as some other people's place, so it's risky leaving at that time. So we begged if we could move the time closer, and they gave us 12 p.m., which is a very early time. But yeah, so when you're on call, you get to see new patients. I've never done it before, but what I've heard from other people who are on call, you get to see new patients with the doctor that is there. I'm using this perfume. Don't worry, you are not in frame. I'm using this perfume, the happiness perfume. This is the pack. Guys, this perfume is strong. Oh my god. Like I'm in the pulmonology unit, and for my first posting, I started on, was it Tuesday? Yes, I started on Tuesday, a busy Wednesday. Yeah, I think it's on Wednesday I started. Yes, and I'm in pulmonology, right? And I used this perfume, and it was strong. Like I felt it was strong, and I know that is like wrong. You're not supposed to be using heavy perfumes. Yeah, so as not to trigger some people's condition, like asthma and the rest. But yeah, so what we do in pulmonology unit is that we see a lot of respiratory cases. We see a lot of cases with lungs and the rest. But funny enough, right, in internal medicine, one thing I've learned is that because you're in pulmonology does not mean you will not see a cardio case or you will not see a nephro case, because basically they see each other's cases. Like if there is no nephrologist on standby, you have to like manage and handle that case pending when the nephrology unit comes. So basically, even when I went on my first day, I realized that they were managing a nephro case. It wasn't even a pulmonology case. So yeah, you just get exposed to a lot of things, guys. So I'm just trying to get ready. I need to read up some things before going. If not, my clerking will be horrible. So guys, I'll try and show you what I can show you. Then yeah, we'll talk later. Bye.
Yes, sir. How are you today? I'm fine. How are you today? You have to